Define anemia. Enumerate the causes and classification of anemia. Anemia is defined as a reduction in the number of circulating RBCs. Anemia can be classified based on underlying cause or morphology of RBCs. Table 6.1 shows about classification of anemia. Anemia is broadly classified into two categories based on underlying process and based on the morphology of RBCs. Based on underlying processes include decreased RBC production, increased RBC destruction, and blood loss. Under the heading of decreased RBC production, we have iron, vitamin B12 or folate deficiency. Next one, bone marrow disorders like aplastic anemia, pure RBC aplasia, myelodysplasia, tumor infiltration. Next one is bone marrow suppression. Example, drugs, chemotherapy, irradiation. Next one is low levels of trophic hormones which stimulate RBC production, such as erythropoietin, for example, chronic renal failure, thyroid hormone, which include hypothyroidism, and androgen, which include hypogonadism. Next one is anemia of chronic disease or inflammation. These are different causes of decreased RBC production. Now we'll go in detail about increased RBC destruction. Inherited hemolytic anemias, example hereditary spherocytosis, sickle cell diseases, thalassemia major, and PNH. Acquired hemolytic anemias, example Coombs positive autoimmune hemolytic anemia, hemolytic uremic syndrome, malaria, hypersplenism. These are the causes under the increased RBC destruction. Next we will go in the section of blood loss. Blood loss can be acute blood loss such as trauma, hematemesis, hemolysis. Chronic blood loss, example slowly bleeding ulcer or carcinoma. Induced bleeding, example repeated diagnostic testing, hemodialysis, losses, excessive blood donation. So these are the causes under the blood loss. So next we'll go in the next classification, which is based on the morphology of RBCs, which include microcytic anemia, macrocytic anemia, normocytic anemia. Microcytic anemia means MCV below 80 femtoliter, which include iron deficiency, anemia of chronic diseases, thalassemia, copper, vitamin C, and pyridoxine deficiency. Coming to the macrocytic anemia, which is MCV above 100 femtoliter, which include vitamin B12 and folate deficiency, drugs interfering with nucleic acid synthesis, that is zidovudine and hydroxyurea. And then abnormal RBC maturation, example myelodysplastic syndrome, acute leukemia, LGL leukemia, alcohol abuse, liver disease, and hypothyroidism. So these are the causes under the macrocytic anemia. Coming to the normocytic anemia, which means MCV is normal, that is between 80 and 100 femtoliter, which include acute blood loss.